And what is massive blood transfusion? There is a blood transfusion, you all know. There is an entity called massive blood transfusion, which is the question they'll ask you. Massive blood transfusion is more than 10 units per 24 hours. More than 10 units per 24 hours. Okay. Yesterday I was telling you indication for surgery in duodenal ulcer. What was that? Regarding blood transfusion, I was telling you one point yesterday. Anyone remember?
Sir, you're asking causes of duodenal ulcer?
No. Yesterday, while we were discussing duodenal ulcer, I told you one indication for surgery is
bleeding.
Yeah, bleeding and massive bleeding like this. If you are not able to control the bleeding with endoscopy for 2 times, or if you are giving more amount of blood units, like more than 10 units per 24 hours, then you have to go for surgery there. Yesterday we were discussing that. That is massive blood transfusion. So what will be associated with massive blood transfusion is TRALI. It is transfusion related acute lung injury. Okay, these are new names added, fancy names. So just they may ask you, just for completion sake, I am completing it. Transfusion related acute lung injury and TACO. That is, anybody heard about it before?
Only in Mexican stuff.
Transfusion associated circulatory overload. These are the new terms. So just keep in your mind. Transfusion related acute lung injury. That is TRALI. TACO is transfusion associated circulatory overload, and there will be electronic imbalances like hypothermia will be there, calcemia will be there, kalemia will be there, hyperkalemia will be there. So all type of electrolytic disturbances will be there. And what will be the cause of death? Coagulopathy. The patient will ultimately bleed because of this massive transfusions. Whatever the clotting factors will be used up. So he will be ultimately dying because of coagulopathy. We call it as DIC. Disseminated intravascular coagulation. So prevention of coagulopathy is the key in massive blood transfusion. And finally, sepsis. This we have discussed. What is SIRS?
Systemic inflammatory response.
What are the components of SIRS?
Increased inflammation due to trauma.
See, there are 4 parameters: heart rate, respiratory rate, temperature, and WBC count. If these 4 are out of these 4, any 2 are increasing, then we will tell that the patient is in sepsis or is having SIRS, systemic inflammatory response syndrome. These patients will ultimately develop sepsis. Okay. And there is a score to assess them. What is the score? Is sequential organ failure assessment. Sequential organ failure assessment score.
So once again, sorry to disturb. Heart rate, WBC count, respiratory rate, and temperature.
Temperature.
Okay.
Temperature, body temperature.
Okay.
Out of these 4, if any 2 are raised, that means that the patient is in sepsis. Okay.
Okay, sir. And so.
And there is a score for sepsis. Yeah, there is a score for sepsis that is known as SOFA score, sequential organ failure assessment score. Okay, just no need to go into the details, just elaboration of that is enough. They may ask you, what is SOFA score? Sequential organ failure assessment score. Where is it used? It is used in sepsis. Okay.
Okay, sir.
And this is for assessment of nutrition. Okay. So what is this?
Trials
Are you able to see the screen?
The feeding tube.
It is the feeding tube or the Ryle's tube.
Ryle's
It is
tube.
known as Ryle's tube. Okay. It has a lead here. This is for marking. When you put it inside, is a nasogastric tube or a nasojejunal tube, we call it as, and it has a lead marking here, so that it will be radio opaque. Okay, so this is a Ryle's tube for feeding. This is for giving feeding for the patient. Ryle's tube. And what is this?
Set.
He did a endoscope. Surgeon did a endoscope. He has marked a place, and percutaneously we are putting a tube inside. So it is percutaneous endoscopic gastrostomy. Okay, percutaneous endoscopic gastrostomy. So this is also for feeding. Okay, just remember these two. And what tube I showed you in the morning? One tube I showed you.
T-tube.
What is that? T-tube. Yeah, T-tube cholangiogram. T-tube is for choledochal. Choledochal cholangiogram we did T-tube. This is the feeding tube. The length of the feeding tube is 105 centimeters. Okay, this is to give nutrition to the patient. And the same way, this is also a percutaneous endoscopic gastrostomy. Okay, just remember these three images. Okay.
Okay, sir.